Hi, hello friends. Good morning. Good morning to everyone. Welcome to our channel, The Voice of Nurse. Today we are going to discuss a new topic, means a new model paper for staff nurses 2023 exam purpose. We are going to discuss today part 1 related to the new set of model paper, means we already finished 4 sets of model paper. This is fifth set of model paper related to the staff nurse 2023. Here today we are going to discuss part 1. Today's class we are going to discuss part 1 model paper regarding fifth set. Actually, in today's class, we had to discuss related to the important topics related to the nursing, but nobody has given a positive response. And in previous class, we discussed nursing research. In nursing research promo, in yesterday's class, nursing research in promo. Nursing research last part 3 promo, I already given an explanation related to the next class. If anybody want to me to make a video related to the important topic of nursing subjects, especially MHSRB purpose, but nobody has given comment like we need a important topics related to the nursing subject, please make a video like that. Nobody has given comment and nobody has responded about that particular topic. That's why we are discussing today model paper as usual. So today we are going to discuss fifth set of model paper. Before moving on to topic, what we finished till now we will discuss briefly. Till now we finished syllabus review, anatomy and physiology, microbiology, fundamentals of nursing, first aid, community health nursing, nutrition. All subject related to the nursing point of view, very important, and FAQs, frequently asked question in previous years papers. We already discussed each and every subject. Each subject we discussed. First session 100 question we already finished each subject. Almost we finished 2000 questions, 2000 MCQs, all subjects. With all subjects, model papers, NHM, these all things included. 2000 MCQs already finished. Anybody here new to this channel, please check it all subject before the exam. Plus medical surgical nursing, sociology, midwifery and gynecological nursing, child health nursing, mental health nursing, along with these subjects, plus CPR, NHM solved papers 2 set, model papers 2 sets, plus already previously we discussed 2 sets and recently we finished 2 sets, means 4 sets we already discussed. 3 sets of model papers plus 1 set of mock test, MHSRB mock test also we discussed previously. Then last class we finished nursing research point of view 100 questions also. Anybody here new to this channel, please check it once and be prepared for the exam, because we are having short period of time. We are having only 10 to 12 days only time duration is there. Time period is 10 to 12 days only is there. Please check it once before the exam. Everyone be ready for the exam. Anybody not known about this channel, please share the video to your friends, because each and every question very important question, and FAQs also, frequently asked questions previous years also. Today's class we are going to discuss model paper set of 5, means fifth set. Staff nurse 2023 purpose we are going to discuss. Today class was part 1 related to the model paper set 5. Here, before moving on to topic, a small request friends. Here anybody new to this channel, please subscribe my channel, click on the bell icon for further notification. Please give a like and share the video to your friends, and please share your opinion in comment section. Not only opinion, if you have any doubts you can ask in comment section, and also please share any positive or negative things also you can share with me. And also one more thing, anybody want to me prepare a video related to the important topics before the exam, I will make a video. You people can prepare for the important topics also. Here anybody want to me make a video, means please give a comment. Let's move on to today's class. Model paper set 5 for staff nurses 2023 part 1. Question number 1. Tube testing is done under. Tube testing is done under. We will see here option. Option A, ketamine. Option B, general anesthesia. Option C, no anesthesia. Option D, local anesthesia. How is tube test done? We will see now. The fluid is placed through the cannula or tube into the uterus. Here tube means fallopian tube, don't confuse friends. The fluid is placed through the cannula or tube into the uterus and fallopian tubes. The fluid may cause cramping. If the tubes are blocked, the fluid will cause them to stretch. X-ray images are taken as the fluid fills the uterus tubes. Here, the test for tubes in pregnancy. In case of pregnancy, the tube test and by the hysterosalpingogram. Hysterosalpingogram is an X-ray dye test that allows the provider to see the uterus and fallopian tubes. It can help the provider diagnose fertility problems arising from having blocked fallopian tubes. Test tubing is done. Some women only have mild cramps, and while someone may complain the excruciating pain, especially if tubes are blocked. If the client is feeling very much scared of pain, may request it to be done under the short general anesthesia. But here no anesthesia is used for the tube testing. Under the no anesthesia, here option C is the correct answer. A small injection of anesthetic will be administered into the cervix. The hysterosalpingogram catheter will be advanced into the uterus. If tubal blockage is identified, the doctor may proceed with additional procedures to open the blocked tubes. So here option C, no anesthesia is the correct answer. Tube testing is under the no anesthesia. Option C is the correct answer. Next we will move on to question number 2. The uncommon change to occur in a myoma is. What is the uncommon change in occur in the myoma? We will see here options. Option A, calcification. Option B, red degeneration. Option C, malignant change. Option D, hyaline change. What is meant by myoma? We will see first. Myoma is also called as uterine myoma or fibroids. Non-cancerous growths in the uterus that can develop during a woman's childbearing years. The cause of fibroids is well understood. Risk factors include family history of fibroids, obesity, or early onset of puberty. Myomas are smooth, non-cancerous tumors that may develop in or around the uterus, made partly of muscle tissue. Myomas seldom develop in the cervix, but when they do, they are usually myomas in the larger upper part of the uterus as well as a rare case of malignant transformation of uterine leiomyoma. Leiomyoma is reported. A age of 54 years old lady, nulliparous and 2 years post menopausal period. Here the fibroids common symptoms of myoma are small non-cancerous tumors or clusters of tumors that can grow in the walls of uterus. Symptoms includes heavy menstrual bleeding, constipation, lower back pain, pain during the sex. Treatments includes medication, embolization, ablation, MRI, ultrasound therapy, and surgery. Here option C, malignant change is the correct answer. Uncommon change to occur in the myomas is malignant change. Additionally, we will see left of the options also. Calcification. What is meant by calcification? Calcification is the accumulation of calcium salts in the body tissue. Nothing but a buildup of excessive or excess calcium in the body. What is meant by red degeneration? Red degeneration is a hemorrhagic infraction of the uterine leiomyoma, which is well-known complication especially during the pregnancy. Option C, malignant change. Malignant transformation of cell produces radical changes in their metabolism and the soluble factors they produce. These changes support rapid cell proliferation and facilitate their invasion into the surrounding tissues as well as distant metastatic spread. And what is meant by hyaline change? Hyaline change is the homogeneous glassy pink appearance in the histological sections stained with hematoxylin and eosine. It can be due to the intracellular accumulation of certain substances as multimyeloma. Here in this option, option C is the correct answer, malignant change. Next we will move on to question number 3. Which of the following is not a complication of prolapsed uterus? Here in this following option, which one is not a complication of prolapsed uterus? We will see here options. Option A, UTI, urinary tract infection. Option B, prolapse of pelvic organ. Option C, decubitus ulcer. Option D, prolapsed bladder. Meant by prolapsed uterus. The uterine prolapse occurs when the muscles and tissue in the pelvic weaken. The weakness lets the uterus drop down. There also are fewer complications. How serious is prolapsed uterus? Means uterine prolapse can disrupt normal activities and be uncomfortable. Very mild cases may not require the surgical management. Prolapse of the other pelvic organs. If uterine prolapse occurs, prolapse of the other pelvic organs including the bladder and rectum is possible. A prolapsed bladder bulges into the front part of the vagina, causing a cystocele that can lead to difficulty in urinating and increased risk of urinary tract infections. The complications of prolapsed uterus. Uterus can protrude from the vaginal opening. Complications can include ulceration of exposed tissue and prolapse of other pelvic organs such as bladder or rectum. Here we are having the complications like urinary tract infection, prolapse of other pelvic organs and prolapsed bladder. Here not a complication of prolapsed uterus is option C, decubitus ulcer. What is meant by decubitus ulcer? We will see now. Bed sore or pressure ulcer, injury to the skin and underlying tissue resulting from the prolonged pressure on the skin. People most at risk are those with condition that limits their ability to change a position. What is meant by decubitus ulcer? Means decubitus ulcer occurs when there is prolonged pressure on the specific areas of the body that are susceptibility to friction and shear the force injuries. When an area of skin placed under the pressure, in that situation pressure sores or bed sores or decubitus ulcer will happen. Damage to an area of the skin caused by the constant pressure on the area of long time is called as decubitus ulcer. Here from the following option, not a complication of prolapsed uterus is option C. Next we will move on to question number 4. Laparoscopy is used in the diagnosis of. Laparoscopy is used in the diagnosis with the using of the laparoscopy. What we can diagnosis? We will see here option. Option A, endometriosis. Option B, cancer of rectum. Option C, cancer of uterus. Option D, cancer of cervix. Is laparoscopy? We will see first. Laparoscopy is a diagnostic procedure. Laparoscopy is a type of surgical procedure that allows a surgeon to assess the inside of the abdomen or tummy and pelvic without having to make large incision in the skin. This procedure is also known as keyhole surgery or minimally invasive surgery. Laparoscopy procedure is also called as keyhole surgery or minimally invasive surgery. A laparoscopy is a type of surgery that lets a surgeon looks inside of the body without making a large incision. Laparoscopic surgery classified as major or minor surgery depending on the nature of the procedure performed. Most laparoscopic procedures are major surgeries, but gallbladder removal, cholecystectomy, gallbladder removal means cholecystectomy, and tubal ligation, these all are the minor surgeries. Laparoscopy is used to help diagnose the cause of symptoms in the belly or pelvis. It is usually done if imaging tests such as X-rays, ultrasounds, MRI scans haven't provided enough information to confirm a diagnosis. The test is often used to help diagnose digestive diseases. Laparoscopy is used in the diagnosis of endometriosis. Surgery is currently the only way to confirm a diagnosis of endometriosis. The most common surgery is called as laparoscopy. In this procedure, the surgeon uses an instrument to inflate the abdomen slightly with a harmless gas. We are having two types of laparoscopic procedures. First one is a telescopic rod lens system. Second one was a digital laparoscopic procedure. both procedures are in the laparoscopic procedures. We are having two types. Laparoscopic is used to diagnose the endometriosis. Here option A is the correct answer. Next we will move on to question number 5. Most important structure preventing uterine prolapse is. Here in these options, which one is most important structure preventing the uterine prolapse? Already we discussed related to the uterine prolapse in previous two questions back. But here, what is the most important structure is preventing uterine prolapse? We will see here options. Option A, round ligament. Option B, cardinal ligament. Option C, broad ligament. Option D, uterosacral ligament. Normal pelvic organ support is provided by the interaction between the levator and the muscles and the connective tissues that attach the uterus and vagina to the pelvic side walls. The levator and the muscles hold the pelvic floor closed and provided lifting and closing forces to prevent pelvic floor descent. Which most important ligament to prevent a uterine prolapse means here cardinal ligament or McEnroe ligament. It attaches from the lateral side of the cervix and vagina to the lateral pelvic wall. The function of this ligament is ligament with uterosacral ligament and other pelvic musculature collaborate to support the pelvic organs and prevent the prolapse. Here the muscles, ligaments and tissues in the pelvis are called as pelvic floor muscles. We will see left options also. Option A, round ligament. What is round ligament? We will see one by one. Round ligament is a rope-like band of connective tissue. Two round ligaments support the uterus during the pregnancy. The round ligaments stretch as the uterus grows. Option C, broad ligament. Broad ligament of the uterus is a double layer fold of the peritoneum that attaches lateral portion of the uterus to the lateral pelvic side walls. This is meaning of broad ligament. Next option D, uterosacral ligament. Uterosacral ligaments are thick bands of connective tissue that help support the uterus. They travel from the base of the uterus to lower spine. Endometriosis is a common problem associated with the uterosacral ligament. Here the most important structure preventing the uterine prolapse is cardinal ligament. Cardinal ligaments originate from the lateral pelvic wall and attach on the lateral cervix and vagina. So here option B is the correct answer. Next we'll move on to question number 6. Which of the following disorders result from a deficiency of factor VIII? From the following disorders, which one is results to the deficiency of factor VIII? Here factors means coagulation factors only. Don't confuse here. We will see options first. Option A, sickle cell anemia. Option B, Christmas disease. Option C, hemophilia A. Option D, hemophilia B. We will discuss related to the coagulation factors also. The clotting factors are Factor 1, fibrinogen. Factor 2, prothrombin. Factor 3 is tissue thromboplastin or tissue factor. Factor 4 was ionized calcium. Factor 5 was liable factor or chloracillin. Factor 6th one unassigned. 7th one was stable factor or pro-converting. Factor 8th one was anti-thrombophilic factor. Anti-thrombophilic factor. This question we are having factor VIII means anti-thrombophilic factor related question only. We will see what is the cause of deficiency related to the factor VIII from the following option. The coagulation factors are proteins in the blood. They help form blood clots to stop bleeding when you have an injury. Certain risk factors such as obesity slow the flow of blood in the veins, while others such as age can increase body's natural ability to clot. Blood clotting factors or deficiency of factor VIII was the disorder. Following disorder was hemophilia is X-linked recessive disorder caused by the deficiency of functional plasma clotting factor, which may be inherited or arise from the spontaneous mutation. Hemophilia is sometimes referred to royal disease. Sometimes hemophilia is called as royal disease because it affected the royal families of England, Germany, Russia and Spain in the 19th century and 20th century. Option C is the correct answer, but we will see left options also. Sickle cell anemia. Sickle cell anemia that block blood flow to organs, deprive the affected organs of blood and oxygen. The sickle cell anemia blood is also chronically low in oxygen. This lack of oxygen rich blood can damage nerves and organs including kidneys, liver and spleen, and also can be fatal. Here option B, Christmas disease. Christmas disease is also known as hemophilia B. Here no need of explanation for the option D. Hemophilia B is also called as Christmas disease. Is an inherited bleeding disorder. It happens when a gene that helps blood clot mutates or changes. People with hemophilia B don't have the usual amount of blood protein that help blood clot. This protein is a clotting factor. Hemophilia is also called as royal disease. Christmas disease is also called as hemophilia B. Hemophilia A is called as royal disease. Hemophilia B is called as Christmas disease. Again and again I am repeating. Why? Because of important, most important. In case we are having exam like hemophilia is also called as, otherwise hemophilia B is also called as, like we will get a question in exam. That's why I am explaining clearly. So here, which of the following disorder results from a deficiency of factor A? Option C, hemophilia is the correct answer. Hemophilia A. Next we will move on to question number 7. What is the most common complication of myocardial infraction, MI? What is the common complication of MI? We will see here options. First option M, cardiogenic shock. Option B, heart failure. Option C, arrhythmias. Option D, pericarditis. Myocardial infraction is a blockage of blood flow to the heart muscle. A heart attack is medical emergency. A heart attack is also called as myocardial infraction. Usually occurs when blood clot blocks blood flow to the heart. Without blood, tissue loses the oxygen and dies. The myocardial infraction happens when one or more areas of the heart muscles don't get a sufficient oxygen or enough oxygen. This happens when the blood flow to the heart muscle is blocked. The common complications of myocardial infections like ventricular septal rupture, left ventricular aneurysm, arrhythmias, emboli, mitral regurgitation. Here we are having option C, arrhythmias. So here option C, arrhythmias is the common complication of myocardial infraction. So we will see left options also. Cardiogenic shock, option A. Cardiogenic shock is a life-threatening condition in which the heart suddenly cannot pump enough blood to the heart. The condition is most often caused by the severe heart attack, but not everyone who has heart attack has cardiogenic shock. Next option B, heart failure. Heart failure is also called as congestive heart failure, a chronic condition in which heart doesn't pump blood as well as it should. Option C, arrhythmias. Arrhythmias is also called as irregular heartbeat, improper beating of the heart, whether irregular, too fast or too slow. Cardiac arrhythmias occurs when electrical impulses in the heart don't work properly. So here the common complication of myocardial infarction is option C, arrhythmias. Option D, pericarditis. Also we will see what is meant by pericarditis. A swelling and irritation of the thin sac-like membrane surrounding the heart is called as pericarditis, means infection to the pericardium. Here option C is the correct answer. Next we will move on to question number 8. Systems of adenomyosis is. Symptoms from the following related to the condition of adenomyosis. We will see first options. Option A, menorrhagia. Option B, dysmenorrhea. Option C, A and B. Option D, infertility. What is meant by adenomyosis? We will see. Adenomyosis is a condition which endometrial tissue exists within the and grows into the uterine wall. Adenomyosis most often occurs late in the childbearing years and typically disappear after the menopause. Adenomyosis occurs when the tissue that normally lines the uterus, means endometrial tissue, grows into the muscular wall of the uterus. The displaced tissue continues to act normally, thickening breaking down and bleeding during each menstrual cycle. Adenomyosis symptoms like heavy or prolonged menstrual bleeding, severe cramping, pain during intercourse or blood clots that pass during a period. Heavy prolonged menstrual bleeding, severe cramping or sharp. So here in these options, option A and B is the correct answer. Adenomyosis symptoms enlarges uterus, feelings of abdominal bloating, fullness or heaviness, heavy bleeding during periods means menorrhagia, and pain during the sex also. Periods is also termed as menorrhagia. Heavy or prolonged vaginal bleeding with menstrual cycle is called as menorrhagia. Menstrual cramps is called as dysmenorrhea. Cramps and pelvic pain with menstruation with common cause such as heavy flow, passing clots, uterine fibroids or endometriosis. These all are the symptoms related to the adenomyosis. Here option A, menorrhagia and dysmenorrhea is the correct answer. C, option A and B. Next we will move on to question number 9. Which of the following terms describes a decreased number of platelets? Here in this following option, which was termed as describes as a decreased number of platelets? We will see here options. Option A, thrombectomy. Option B, thrombocytopenia. Option C, thrombocytopathy. Option D, thrombocytosis. The term for decreased platelet count is called as thrombocytopenia. Here option B is the correct answer. Directly I am revealing answer by because of this is easy question only. Thrombocytopenia is a condition that occurs when the platelet count is too low. Platelets are tiny blood cells that are made in the bone marrow from the large cells. Thrombocytopenia is a condition in which the low blood platelet count. Platelets are colorless blood cells that helps to the thrombocytes. Here the decrease of platelets means what is the causes of the thrombocytopenia. Bacterial and viral infection may lower your the platelet levels, and alcohol use disorders. Alcohol slows platelet production. Drinking a lot of alcohol may cause a platelet level to drop. Toxic chemicals also sometimes they cause of the decreases of platelets count. Low results mean that the platelets are smaller than what's considered normal. Here what is the normal number of platelets? What is the normal value of the platelets? The normal platelet count is in adults ranged from the 1,50,000 to 4,50,000 platelets per microliter of blood. A platelet counts of less than 1,50,000 platelets per microliter is lower than normal. When you have a low platelet count, you may have trouble stopping bleeding. Here we will see left options also. What is meant by thrombectomy? Surgery to remove a thrombus or blood clot from the blood vessels is called as thrombectomy. Next option be thrombocytopenia. Low platelet count is called as thrombocytopenia. Next option C, what is meant by thrombocytopathy? Here name itself is their pathy, group of disorders we are seeing here. Thrombocytopathy is any of several blood disorders characterized by dysfunctional platelets which results in prolonged bleeding time. Here the meaning of thrombocytopathy means any several blood disorders characterized by dysfunctional platelets which result prolonged bleeding time, defective clot formation and tendency to hemorrhage. These are the conditions related to the thrombocytopathy. Next option B, what is meant by thrombocytosis? Thrombocytosis is a disorder in which the body produces too many platelets is called as thrombocytosis. It's called reactive thrombocytosis or secondary thrombocytosis when the cause is an underlying condition such as an infection. So here in this option B is the correct answer. Next we will move on to question number 10. Osteomyelitis. Osteomyelitis most commonly result of. We will see here options. Option A, drugs. Option B, immune suppression. Option C, bone infection. Option D, damage. What is meant by osteomyelitis? Osteomyelitis is an inflammation of bone caused by infection generally in the legs, arm or spine. Bone infection is also called as osteomyelitis. Infections can reach bones by traveling through the bloodstream or spreading from nearby tissues. Causes of osteomyelitis. Most cases of osteomyelitis caused by Staphylococcus bacteria, types of germs commonly found on the skin or in the nose of even healthy individuals. Some common complications of osteomyelitis. Related to the osteomyelitis, complications are septic arthritis, pathological fractures, squamous cell carcinoma, sinus tract formation, abscess, bone deformity, systemic infections. These all are the comes under the complications of osteomyelitis. Osteomyelitis is a painful bone infection without antibiotic or other treatment. This procedure may result in a bone deformities. When osteomyelitis results from infection nearby soft tissue or direct invasion by the organism, that area over the bone swells and become painful. The signs and symptoms of osteomyelitis include fever, swelling, warmth and redness over the area of the infection. Osteomyelitis is a serious infection of bone that can either acute or chronic. Here, osteomyelitis most commonly result of bone infection. Due to the bone infection, result of bone infection, we will get a osteomyelitis. So here in this option C is the correct answer. The pathophysiology of osteomyelitis trends to occult local blood vessels which cause bone necrosis and local spread of infection. Here option C is the correct answer. Next we will move on to question number 11. Which of the following indicators would show the condition of the client with ARDS? ARDS means acute respiratory distress syndrome here. Which of the following indicators would show the condition client with acute respiratory distress syndrome improving? We will see here options. Option A, ABG values. Option B, blood pressure. Option C, bronchoscopy. Option D, sputum culture. There is no specific test to identify the ARDS. The diagnosis is based on the physical exam, chest x-ray and oxygen levels. It also important to rule out the other diseases and condition. For example, certain heart problems that can produce similar symptoms. When a symptoms of ARDS occurs, a combination of tests may be done. Chest x-ray to measure fluids in the lungs, a blood test to determine oxygen levels in the blood to help determine the severity of ARDS, echocardiogram, ultrasound of the heart to evaluate the heart function. ARDS is a life-threatening lung injury that causes dangerously low oxygen levels in the blood. How we will identify low oxygen levels in the blood means through the ABG. ABG diagnosis of ARDS based on the following criteria: acute onset bilateral lung infiltrates on chest radiography of non-cardiac origin and PaO or FiO ratio of less than 300 mm of Hg. The diagnostic evaluation of ARDS. Doctor may have undergo some following procedures like different tests may be appropriate, different ages. Blood test measure oxygen levels in the blood is ABG. Using sample of blood taken from the artery. ABG blood test sample blood taken from the artery. Yellow blood oxygen levels might be sign of ARDS. ARDS is a condition which fluid collects in the air sac of lungs, depriving oxygen organs of oxygen low level. Acute respiratory distress syndrome can occur those who are critically ill or who have significant injuries. Through the ABG test, we can identify the ARDS, then we can treat the ARDS as soon as possible. So here in this option A is the correct answer. Next we will move on to question number 12. Drug abuse of which substance shows symptoms similar to schizophrenia? If some drug is abused from the client, which drug substances will show the symptoms similar to the schizophrenia? We will see here options. Option A, LCD. Option B, heroin. Option C, amphetamine. Option D, cannabis. Here what is schizophrenia? Related to the psychiatric cases and condition terms we already discussed in mental health nursing. Just see once there. Related to the psychiatric condition and drugs related condition we already discussed in mental health nursing. Briefly we will see here what is schizophrenia. Schizophrenia is a serious mental condition of type of involving a breakdown in the relation between thought, emotion and behavior leading to faulty perception, inappropriate actions and feelings, withdrawal from reality and personal relationship into the fantasy and delusion. The studies have shown using drugs, particularly amphetamine or LSD, cocaine, can increases the risk of developing schizophrenia, psychosis or similar illnesses. It is not clear if using drugs directly causes symptoms in people who are susceptible to schizophrenia or if they are more likely to use drugs. The substances abuse does not cause schizophrenia, but the chronic excessive misuse of alcohol or drugs can increases the frequency of severity of psychotic episodes. In particular, drugs like LSD and other hallucination drugs or amphetamines have been linked with schizophrenic episodes. Some drugs like cause the psychosis either during use of withdrawal or from the drugs like alcohol, cocaine, hallucinations, drugs like LSD, amphetamine, sedatives, opioids. These all things comes under the side effects related to the schizophrenia. Drug abuse. So here drug abuse, which of the substances show symptoms similar schizophrenia means amphetamine is the correct answer, option C. Next we will move on to question number 13. Recurrence of a disorder or symptoms after apparent recovery is called as, we will see here options directly. Option A, relapse. Option B, reputate. Option C, rapport. Option D, remission. Related this question also will discussed in psychiatric nursing or mental health nursing previously. Disease recurrence also called as relapse. Disease recurrence is also called as relapse. They define as relapse as return of symptoms to the full syndrome criteria for an episode during remission but before recovery. Recurrence of a depressive episode after recovery, it is thought to be related both the condition related to the depressive condition. Here disease occurrence is also called as relapse. We will see also left option, repute and rapport remission. What is meant by reputate? Reputate is a reabsorption of a neurotransmitter by neurotransmitter transporter located along the plasma membrane of axon terminal. Reputate is the primary mode of inactivation of GABA that is released from the neurons. Next we will see what is meant by rapport. Rapport means good understanding of someone and an ability to communicate well with them. Rapport is a close and harmonious relationship between the two peoples. Option D, remission. What is meant by remission? A decrease in or disappearance of signs and symptoms of cancer. In partial remission, some but not all signs and symptoms of cancer have disappeared. In complete remission means all signs and symptoms of cancer have disappeared. Here remission means nothing but disappear. Here recurrence of a disorder or symptoms after the apparent recovery is called as relapse. Option A is the correct answer. Next we will move on to question number 14. How much time is required for the spermatozonium to develop into a mature spermatozoa? What is the duration of time is required for the spermatozonium to develop into the mature spermatozoa? We will see options. Option A 21 days, option B 32 days, option C 64 days, option D 82 days. The process of germ cells development during the spermatogenesis can be divided into 5 successive stages. First one is spermatogonia, second one primary spermatocytes, third one secondary spermatocytes, fourth one spermatides, fifth one is spermatozoa. The mature spermatides means fourth stage delivered from the germinal epithelium as spermatozoa are transported through the epidermal duct system during the additional 12 days. Means here we are having the approximately duration of period is 64 days. Spermatogonia destinated develop into the mature sperm also known as primary sperm cell. The spermatogonium is an undifferentiated male germ cells. Spermatogonia undergone spermatogenesis to form a mature spermatozoa is semiferous tubulus of the testis. Sperm is produced into the testis where it takes approximately 10 weeks for a single sperm to reach maturity. Every day, a healthy adult male can produce around 70 to 150 million Sperm. Spermatogenesis takes an average 64 days from start to finish, but this varies between the individuals. Immature sperm cells will be divided multiple times within the testes, resulting in the production of the tadpole-like cell we recognize as sperm. Spermatogenesis phase is completed with maturation of spermatozoon. The time duration is 62 to 75 days. Exactly was 64 days here. Option C is the correct answer. Next we will move on to question number 15. Which of the following is used in colposcopy? Here not colonoscopy. Which of the following is used colposcopy? We will see options first. Option A, acetic acid. Option B, providine iodine. Option C, methylene blue. Option D, gentian violet. What is meant by colposcopy? Colposcopic is a diagnostic procedure. A colposcopy is a test to take a closer look at the cervix. The cervix is the opening to womb from the vagina. A colposcopy is often done. The cervical screening finds changes in the cells caused by certain types of HPV, human papilloma virus. These changed cells can turn into the cervical cancer cells. Colposcopy is used to find cancerous cells or abnormal cells that can become cancerous in the cervix, vagina or vulva. Which of the following is used in colposcopy? Means option A, acetic acid is the correct answer. The other key ingredient in colposcopic practice, 3 to 5% acetic acid is usually applied with a cotton applicator or with a small sprayer. It helps in coagulating and clearing the mucus. It is reasonable to conclude that the best time to identify lesions is 1 minute after the application of acetic acid. Continued evaluation for the up to 3 minutes may be considered reasonable for the optimal high-grade squamous intraepithelial lesions. Applying acetic acid to the cervix followed by the colposcopic assessment with or without colposcopically directed biopsy is the standard test for the identify any cancerous cell in the cervix. So here in these options, option A is the correct answer. Colposcopy used with the acetic acid. Used in colposcopy was acetic acid. So here in this option, option A is the correct answer. Next we will move on to question number 16. Biochemical etiology of Alzheimer's disease relates to. The biochemical etiology of Alzheimer's disease relates to. We will see here options. Option A, serotonin. Option B, dopamine. Option C, acetylcholine. Option D, GABA. GABA. What is meant by Alzheimer's? Alzheimer's disease is also called as senile dementia, a progressive disease that destroys memory and other important mental functions. Is condition called as Alzheimer's disease. Here, the biochemical etiology of Alzheimer's disease relates to acetylcholine. Acetylcholine released from nerve endings will bind to acetylcholine receptors on the smooth muscle surface, causing sodium channels to open. This allows action potential to travel along cells, which triggers a process that opens to the L-type calcium channel. Here, acetylcholine is a neurochemical that has wide variety of functions in the brain and other organ systems of body. Here option C, biochemical etiology of Alzheimer's disease relates to acetylcholine. Here option C is the correct answer. We will see left options also. Option A, serotonin. Serotonin is a monoamine neurotransmitter. Biological function is complex and multifaceted, modulating mood, cognition, reward, learning, memory and numerous physiological processes such as vomiting and vasoconstriction. Next option B, dopamine. Dopamine is a neuromodulatory molecule that plays several important roles in the cells. It is an organic chemical of the catecholamine and phenethylene families. Dopamine consists of about 80% of catecholamine content in the brain. Next option D, GABA. GABA means gamma aminobutyric acid. GABA means gamma aminobutyric acid is a neurotransmitter, a chemical messenger in the brain. Here biochemical etiology of Alzheimer's disease relates to the acetylcholine. Option C is the correct answer. Next we will move on to question number 17. Which of the following is a characteristics of hysteria? from the following option, which is the characteristics of hysteria? We will see here options. Option A, motor deficit. Option B, unstable emotions. Option C, suicidal attempts. Option D, alertness. What is meant by hysteria? We will see now. Hysteria is a term often used to describe emotionally charged behavior that seems excessive and out of control. Means here unstable emotions is the correct answer here in this option. When someone responds in a way that seems disappropriated emotional for the situation, they are often described as a hysterical. Hysteria is a written and fact checked by last updated in the article History Conventional Disorder, also called as conversion disorder, formerly called as hysteria. It is a type of mental disorder in which a wide variety of sensory, motor or psychic disturbances may occur. Hysteria symptoms include a wide range of physical and mental issues including blindness, hearing loss, seizures, amnesia, uncontrolled bodily movements or complete loss of movements, heart related to the heart palpitation, emotional outburst, paralysis, fainting, chronic pain, loss of sensation, hallucination and histrionic behavior. These all things related to the symptoms of hysteria. Which of the following is a characteristics of hysteria? Means here option B, unstable emotions is the correct answer here in this option. Option B is the correct answer. Next we will move on to question number 18. What is the molecular formula of cholesterol? What is the molecular formula of cholesterol? We will see here options. Option A, C28H47O. Option B, C27H46O. Option C, C30H46O. Option D, C27H48O. Here the cholesterol formula. Chemically, cholesterol is an organic component belonging to the steroid family. Its molecular formula is C27H46O. Cholesterol is a 27 carbon compound with a unique structure with a hydrocarbon tail, a central sterol nucleus made up of 4 hydrocarbons rings and a hydroxyl group. The central sterol nucleus or ring is a feature of the steroid, all steroid hormones. C27H6O is the molecular formula of the cholesterol. The total cholesterol score is calculated using the equation of HDL level plus LDL level plus 20% of the triglyceride levels. Here, cholesterol is a type of lipid or fat. It travels through the body as lipoprotein. Two main types are high density lipoproteins HDL and low density lipoproteins means LDL. Cholesterol has an important role in the body, but excessive amount can be leads to build up in the arteries. Here molecular formula means option B is the correct answer. C27H46O. Option B is the correct answer. Next we will move on to question number 19. The current surgical modality treatment for renal calculi. What is the current surgical modality treatment for the renal calculi? We will see here options. Option A, medication therapy. Option B, ESWL. Option C, chemotherapy. Option D, radiotherapy. Percutaneous nephrostolithotomy allows fragmentation and removal of large calculi from the kidneys and ureter. Percutaneous procedures have higher morbidity. The percutaneous procedures have higher morbidity than ESWL and uteroscopy, so are generally reserved for large and complex renal stones in the cases which are other two modalities have failed. Current surgical modality treatment for the renal calculi is non-invasive extracorporeal shock wave lithotripsy. Means here option B, ESWL is the correct answer. ESWL means extracorporeal shock wave lithotripsy. It involves use of sound waves to crush the kidney stones into smaller pieces so they can more easily pass into the bladder. Other surgical options like percutaneous nephrolithotomy and uteroscopy, phylolithotomy. These all are the other surgical methods, but here the best treatment modalities for the renal and uteral calculi is ESWL, extracorporeal shock wave lithotripsy. Here option B is the correct answer. Current surgical modality treatment for the renal calculi. Option B is the correct answer. Next we will move on to question number 20. This is last question in this part 1 related to the 5th set of model paper. We will discuss from the 21 to further question in part 2 video. Question number 20. Pupils of the eye becoming fixed. Pupils of the eye become fixed means what is the term used from the option? We will see here options. Option A, mydriasis. Option B, myosis. Option C, A and B. Option D, none of the above. Pupils of the eye becoming fixed, pronounced as mydriasis. Here option A is the correct answer. Easy question only. When the pupil are fixed and dilated as blown pupil, this condition can be symptom of the injury to the brain from the physical trauma or stroke. The opposite word for the mydriasis is meiosis. Here option B is there, meiosis. This is opposite word for the mydriasis is meiosis. Meiosis means the muscles of the iris tightened around the pupil. These muscles controlled whether pupils are large or small. Another name for the meiosis is pinpoint pupils. Here pupil of the eye become fixed termed as mydriasis. The causes for the fixed dilated pupil: central nervous system involvement in the syphilis, diabetes mellitus, brain stem encephalitis. These all things comes under the causes for the pupils of eye becoming fixed. So here option A, mydriasis is the correct answer. This is last question in this part 1. 5th set of model paper. From the 21 question to further question we will discuss in the next class. So this is part 1 related to the model paper set of 5 staff nurse 2023 part 1. This is 5th set of model paper. Part 2 we will discuss from the question number 21 to further questions we will discuss in next class. Thank you so much for watching. Anybody here new to this channel, please subscribe my channel, click on the bell icon for the further notification, and please share the video to your friends, and please share your opinion in comment section. If you have any doubt also you can ask in comment section. Please share your opinion in comment section, and please share the video to your friends. Like a video, comment. Thank you so much for watching. Thank you. Keep watching.